you're welcome back. And okay, I think the videos will be on different days. So hi, you're welcome to my channel. My name is Olukolade, and we have a special guest. We had a session which must have been uploaded before, so if you have not checked it out, please do check it. And that session was on trauma. This session now is on depression. So sir, you're welcome back.
Thank you. It's a pleasure.
So for people who are just seeing it, please can you reintroduce yourself? I'm sorry.
Oh, no problem. The name is Dr Olukolade. I'm a clinical psychologist. We've already mentioned what psychologists do. So
yes, sir. Thank you very much, sir. So if you want to know further, there was like a broader introduction on the previous session, so please do check it out. This session, like I said before, is on depression. And without further ado, let's get to it. So what is depression? Because
okay.
Like trauma, like we said earlier, PTSD has been traumatized. Now, always everybody, I have depression, I'm depressed. They will say it jokingly, but what in its actual sense is depression?
Okay, depression is a mood disorder, and what it means is that it's a feeling that affects our mood, a feeling of extreme sadness, unhappiness. And when we say someone is depressed, there are things that we are saying, and the first one is that there's a feeling of sadness, overwhelming sadness that an individual is having. The second thing is that there's loss of interest in things that the person likes to do before, loss of interest in pleasurable activities. Then the third one talks about that the individual has been continuously be unhappy for a period of about 2 weeks. That's those three things are the major things that we are looking at when we are saying someone is depressed. And those things, I'm sure many times when people say that I'm depressed, that's not what they are talking about. People are just talking about something that's happened to me and I'm not happy about it. However, everybody must have had that one time or the other, but that's not the definition of depression. And depression is a very large group of disorder. So a lot of times some people might have something called dysthymia, persistent mood disorder, depressive disorder, and they are saying that it is depression. Sometimes some people have seasonal affective disorder. Sometimes people are having premenstrual mood disorder. A lot of sometimes people are even having something that is more or less of a bipolar affective disorder. So a lot of things are so close to what people many times talk about as depression.
Okay, so I was going to mention that does every worry count as depression? But I think you already explained it.
Yeah, that's worry in itself does not count as depression. However, when an individual is unhappy, extreme unhappiness, and that has been there for 2 weeks or more, then or in more days in the 2 weeks, because many times people say, well, I've not been sad for 2 weeks consistently, but more days in the 2 weeks than not, then we start looking at it, that is that person depressed. Then we have some other symptoms that are not the cause symptoms, because the ones I mentioned are the cause symptoms. So we have some that are not the cause symptoms, and this talks about things like insomnia or sleeping too much, fatigue, sometimes we are not having appetite to eat or eating too much. Sometimes also we talk about when people are losing weight or they are gaining weight excessively. Then also sometimes we talk about when people have feelings of hopelessness, then sometimes when people have guilt feelings, then there are instances where people can be hearing voices of people that nobody is there, but they can hear people talking to them, and sometimes people just feel like killing themselves. Those are some of the things that can come. There are other symptoms, but they are not the core symptoms. The first three I mentioned are the core symptoms that they must be there before we talk about these other ones that I just mentioned.
So you are not depressed. I don't know, but not every worry counts as depression. So if you're just worried and stop using your mouth to say you're depressed or anything. Receive joy in the name of Jesus. So the next question would be, what are the causes of depression? Who are those likely to have it?
Well, from science, a lot of things can actually make an individual to be depressed. And one of those things talks about our environment, where you have you've grown up, the events that are happening around you, early life experiences, things that happen. For instance, a person that has been sexually abused or neglected is probably going to have greater risk of depression, or someone that has a genetic link. For instance, the father or the mother has depression, or the family members, maybe the six elder brother, younger brother, siblings, sisters, then the person has a higher likelihood of having a depressive illness. Then also, being female have a higher risk of being depressed than males. Then also the use of substances. People who use substances, and when you use substances and life takes a negative turn, there's higher risk that an individual is going to become depressed, because you look at what life is giving to other people and what it could have given you and what you have lost. The likelihood of depression seems to be higher. So those are some of the things that pushes depression higher in people. However, then also the economic class that an individual is determines if the lower economic class has higher rates of depression. Now, but the truth there is that anybody can be depressed, whether you are male, female, lower economic class, higher economic class. I've seen very rich people who are depressed. I've seen males who are depressed. I've seen professors who are depressed. I've seen people who have not gone to school who are depressed. So it's not actually that one. It's just science that is trying to tell us that the ratio is higher. However, ratio being higher doesn't mean that it doesn't occur in other classes. So anything can, life events can make people to become depressed.
Right. Yeah. So we've heard that anything can make anybody depressed, and anybody can be depressed. But I want us to talk about depression amongst youths, specifically because youths are, I don't want to say they are going through a lot, because everybody is going through a lot, right? But I feel like there's a certain, I don't know how to put it now, pressure that comes on the young adults that makes them, want to, you must have this at so age, you must do this at so age. I and a friend talked about young and pressured the other day on the channel. So based on that, I feel like that age bracket there's something going on, or it has increased their should I say susceptibility to depression. So can we talk on that?
Yes, true. And that's one of the risk factors also. As I was saying it, I remember that's one of the risk factors, which says that young adulthood and early adulthood are one of the risk factors for depression. And why is because that's the point in our life where our life actually has a meaning. So you want to define what your future will become. So and unfortunately, life doesn't give you everything you ask of it. So sometimes things just don't go the way that we want it to go. So and there is this point in our lives gives the definition for how the rest of our lives is going to be going to pan out. So if a person, for instance, wants to have a business at 25, and by 30 he's still struggling even to get a job, so that tells you that there's likelihood that he's going to become depressed. However, the truth there is that we are the one that is putting timeline on our lives by ourselves. Nobody is actually putting that timeline on our lives. So if you are the one that is telling yourself that I need to have this by this age, life, nobody is actually looking at you to get it at that age. It is you that wants to get it at that point. And if you don't get it at that point, that does not mean that you will not get it even in the next few months, or that another thing might not might not come. So many times young people, especially young adults, look at it that if I'm not married by 28, then that means that I'm a failure. That means that something is wrong with me. That means that I've missed it. And also many times young people are measuring themselves with people who have used over 40 years or 30 years in a particular field, and they want to have the same thing. I have a young colleague who just started a career, and he saw me one day and he said, that look at what you have, I think I should have this. And I looked at it and said, you will just kill yourself. That's just it, because now you are starting something now, and you're looking at somebody that has started this 20 years ago, and you want to be at that place. It's almost impossible what you are going to do. And that's the cognitive, and that's why the problem with depression has to do with our thinking pattern. Your cognitive distortion, thinking that you can actually have the same skills, the same abilities, the same results with someone or with people who have gone ahead years before you. And sometimes it pushes us to do things that we feel bad with our lives. So that's the thing, and that pushes young adults into depressive illness. Sometimes that's also one of the things that sometimes make them to be the people that are prone to use substances to forget the problems, these seemingly big problems in their lives, because they believe that for me not to have had this, then the only thing is let me forget this problem of my life, when all they just need to do is to knuckle their hands down and walk for the time being.
And thank you very much, sir, for that explanation, because I've mentioned, I think I mentioned it sometimes when I was talking about anxiety or something. Someone has told me that statement before, that you just kill yourself. And it's because I have this planning. I just have to plan the next phase. If it's not working that way, I'm calling people, how are you doing it? And my uncle is like an uncle to me. He said, you just kill yourself. And that statement I reflected on it, and I had to just take a step back, just calm down. I even shared, these days my mantra is, I will put my effort in things, but if it still doesn't go well, I'll still be fine. I'm not pressuring myself. I'm not, just taking it a step at a time. Glory to God. Thank you very much, sir, for that explanation. I hope my people are listening. And so how do we overcome depression?
One of the first ways is to change the way we think about our lives. Change the way that you think that things are not working, because the same things that you said is that you are saying that it's not working, that is the prayer of somebody else. So sometimes people say, oh, I've just had a degree and I don't have a job yet. Somebody's just praying that if I can just have a degree first, let things not work, let me just have a degree. And somebody is praying that I don't have a child, somebody just let me just get a husband. Why I'm not saying that we should limit our expectations, no, not at all. But I'm just saying that we should change the way we think, because if we think that it's not working, then irrespective of how big it is, then it's not working. Now, if you think that it is working, no matter how small it is, then it's actually working. And the way we think determines the way we feel. So, and that's why the first thing that we need to do is to change the way we think. Then the other thing is that to understand that ruminative thought does not solve any problem. So when I'm just thinking about something, how it's not working, how bad it is, does not solve any problem. What actually solves problem is problem-solving thinking pattern. So what's the problem? How am I going to overcome it? So if I think about my life and I think about everything is not fine, it changes nothing. It just makes me to become worse off. While if I think about, so it is not working, what have I done wrong? What should I change about it? Then I'm going to know another way of doing it, whether it's going to work or it's not going to work. Then if it's not working, then I change my thinking again and I do problem solving again, and I will see how to make my life go better. So those are some of the things that we need to do about feelings that we have. However, it's good to say quickly that sometimes it's not just about thinking pattern that makes us to become depressed. Sometimes there are hormones in our body that are not balanced. Things are not just right. That makes us to become depressed. So and that's why one of the treatment model for depression is for us to take medications, especially when it is severe. So one of the things that we also need to do that can balance our body, then one of the ways to help ourselves is to eat well. to have balanced diet, to do exercises. For instance, the if you are fatter, heavier, likelihood of you being depressed is higher than someone that is slimmer. Bad news, good news also. But I'm just letting you understand that. So what we eat, how we eat, because of course, if you look at your body and you feel that I'm not looking good, people are not going to like me, you are not going to like yourself, and definitely your mood is going to be low. While someone who is fit, who feels good with himself, probably will feel it's cool to dress in certain ways, to go to parties, to visit friends. So life will be different. So these are some of the things that we need to eat well, we need to sleep well, we need to have friendship. Now whenever I talk about friendship, people say I cannot trust people. I cannot trust strangers with my stories. But I say that I don't say that people should talk their deep secrets with people. But I say that you can have acquaintances that you share fun times together. And you can actually share fun times with people without telling them anything about your life. So those are some of the things that we can actually do. Who go to probably stand-up comedy, stuff like that. Watch things like that. Laugh laugh about life, laugh about yourself. Sometimes people make mistakes, which we do every time anyway. And we start thinking about the mistakes that we've made, probably at night, and you look like, I should have said it this way, I should have done it this way. If you didn't do it the way that you feel that you should, then another thing that you can actually do is to laugh about your life, laugh about things that are not work. Then you will discover that life becomes better.
Yes, like how they took the life now. It's part of life. We are laughing about it. Thank you very much, sir. I'm so grateful. That's actually the last question. The final last question would be that how do we help people, just like we said for the case of trauma, how do we help people living with depression?
And one of the things to do for people living with depression is that we should, as much as possible, not leave them alone. As much as possible, pull them out. As much as possible. Don't forget that word, much as possible, because there are instances that people don't want to go out. They don't want. So just be available if they will require help, and consistently let them know that if you need someone to talk to, I'm available. I'm here to listen. And for depression, most of the time, I tell people that don't just go on and be giving advice. Many times we are just psychologists, everybody. So we want to tell people, do it like this. Of course, your own way of thinking is different. So the thing there most of the time is that just tell people, if you need help, I'm there. But you don't need to offer advice. Just let them be. And if you see that it's getting out of hand, because depression, a lot of people who are depressed might, if it becomes severe, might actually be suicidal. So it's important for us to be attentive to their needs, so that if something wants to get out of hand, then we seek help from outside.
Right, thank you very much for your time. I hope you've learned one thing or the other. This is your piece. These are things you pay for. I'm so grateful that you accepted our request, sir. Thank you very much. God bless you, sir. So thank you for watching. Please like, share, subscribe, do all the stuff, and yes, see you in the next one.